Good morning, everyone. Today is Friday, May 29th, and I know it's been a couple weeks since my last video. That's because everything is going really very good. Right now, we actually have 0 active cases in the entire central zone, which includes Hanna. We anticipate that that will change over time, but right now it's a reason to celebrate and to enjoy. So congratulations everyone on the success of our social distancing measures and the restrictions that we have put in place. As you know, things are starting to lift a little bit, both in the community and medically speaking, and I wanted to update you on some of those changes. Right now, if you want to be seen for a medical appointment, you still contact the medical clinic. You let them know that you need to be seen in person. The directive that we have received through Alberta Health is that we should continue to do phone visits for any visit that is appropriate. This is often going to be things like prescription renewals, but a lot of things do need to be seen in person, things that require any sort of physical examination. If you're unsure what kind of visit you need, talk to the nurse or talk to our receptionist at the front and she will give you directions. All 4 physicians in Hanna are healthy and seeing patients. We have not yet returned to our nighttime clinic. There hasn't been enough demand for that. If you think that's a service that you're ready to get started again because it would benefit you or your family, please let us know, and when there's enough interest to return to the night clinic, we will continue doing that on Wednesdays with Dr. Hanna every Wednesday and the other 3 physicians on a rotating basis. For anyone who needs to go for lab work or a combined lab and x-ray visit at the hospital, please continue to phone the hospital through the 1-800 number that's available below this message. If you have an x-ray appointment alone, or pardon me, if you need an x-ray alone, you don't call that number. You call the hospital directly at 403-854-5252, and they will coordinate an appointment for you. Physiotherapies that are private, which unfortunately we don't have in Hanna, are able to see patients. The one up at our hospital, which is run through Alberta Health Services, is still being told to do virtual visits via phone where possible, but they are opening up shortly here to seeing patients in person when the benefit outweighs the risk. So talk to the physio department if you believe you qualify for that. We are at the clinic right now doing some routine visits, so we are doing driver's medicals, but we are not yet doing annual physicals. When we start doing those, we will let the community know. Final note for you, I only received 1 question this week, which was about whether or not we could go fishing with our grandchildren. And the same restrictions apply with grandchildren as it does with anybody. If you and your grandchild are part of the same cohort family, meaning that you have been isolating together, meaning you are in contact on a regular basis, then you don't have to use masks. You can be less than 6 feet apart. If you are not, then we would recommend that you and your grandchild stay 6 feet apart in that boat. Wearing masks or not wearing masks does not change the 6 feet distance rule. I don't have much else to tell you today. Over the summer months, June, July, August, I'm going to be doing videos on more of a random basis depending on whether or not I have information to share. When there's important health updates for you, I will make a new video. Otherwise, I will be busy at work and relaxing with my family as well. Have a wonderful day, and I will see you all again soon.